Hey guys, Dr. Daniel Sugai, board certified dermatologist. Today's video, we're gonna be talking about when to start anti-aging products or ingredients, because I'm getting a lot of young patients coming in, say teenagers or even tweens, coming into clinic saying that they're using vitamin C serums. So when should you use a vitamin C serum or a retinol for anti-aging purposes? We'll be talking about that in this video. So I just want to say thank you guys for watching these videos and your enthusiasm. As we get into the holiday season, we're going to be thinking about holiday gifts for our loved ones. But we want to make sure it's age appropriate, and you also want to make sure you know what their goals are. If there's hyperpigmentation or fine lines or wrinkles, those are the two things I focus on. You also don't want to offend them either and say, hey, you really need this. Skincare in general just excites people. When I have a lot of access to skincare and I give it away to family, everyone's excited. No one's like, oh, why are you giving this to me? Are you judging me? No, it's just fun to gift skincare. But there are certain ages where you don't need it. And let's go through the ingredients really quickly. Vitamin C, whether it's an ethylated vitamin C derivative or a vitamin C serum with ascorbic acid. Vitamin C serum, as you know, is a very powerful antioxidant that neutralizes free radical damage either from pollution or sunlight. Those work on reducing dark spots and brightening the skin. Brightening the skin is a kind of a confusing term for people to understand, because what does it mean to brighten the skin? It actually means we're just reducing dark spots so that when the light hits our skin, it brightens up. It reflects back at the viewer's eye very well and very evenly. So you have this glowing luminosity to your skin. And when you have a bunch of dark spots, it kind of messes up that reflection of light on our face. And you can see in different forms, like we talked about, ethylated vitamin C, which is a derivative, or you want to go for ascorbic acid, which is the classic form of vitamin C you'll see in Dermatologist CE+F, the Vichy LiftActiv line, the SkinCeuticals C E Ferulic or Maelove, the glow maker. Those all have ascorbic acid, and they are stabilized by vitamin E and ferulic acid to work with it synergistically to brighten your skin. You don't need that in your teens or tweens. People think, oh, it does help with acne though, so I should use a vitamin C. I don't know where that came from, but a lot of patients do come in saying that they're using it for acne, and there's no way that a vitamin C serum will help with acne. Yes, they'll have salicylic acid in a few of them. Roche Posay, Vitamin C Serum, and L'Oreal Revitalift will have salicylic acid, but I say that's better for those with acne prone skin. But once you have acne out on the skin, it will not treat that. If you are in the United States, if you have mild acne, congested pores, whiteheads, blackheads, adapalene 0.1% by Differin or La Roche-Posay, Effaclar are good starts for that, but you don't need vitamin C serums for acne. Unless you deal with a lot of hyperpigmentation, those special cases I can see, maybe you consider a vitamin C serum, but sunscreen is probably the most important for someone with hyperpigmentation in their teenage years. But for us people, like us older millennials, I'm in my late 30s, I have sun damage leading to dark spots, and that's where I think vitamin C is very good. So when do we start vitamin C? Mid to late 20s is a good time to start. I started in my early 30s. When I started social media, I started doing vitamin C much more consistently. And when I saw the benefits of using it, I really wish I started sooner. Late 20s would have been nice, but that's okay. At least I started and I've been consistent with it. The order of which you would do it would be cleanse your face in the morning, apply your vitamin C serum, and then your sunscreen or your moisturizer with SPF. Say La Roche-Posay's Tolerian Double Repair UV or CeraVe's AM Facial Moisturizing Lotion SPF 50. Those are great options to apply over your vitamin C serum. But vitamin C does not replace sunscreen, and I think it's a great product to use in the morning. Retinol. When should you use retinol? If your dermatologist is not prescribing you a retinoid, say tretinoin or adapalene for acne, when do you use retinol for anti-aging purposes? Teens? Early 20s? No, you don't need it. Mid-20s, they say, is a good time to start retinol for anti-aging purposes. So for the teens out there, you don't have to take your parents to Sephora with you and spend a lot of money on expensive drunk elephant retinol or vitamin C serums. Just hold off, okay? Your foundation of skincare should be cleanser, a moisturizer, and a sunscreen. And that's all you need. Retinol is great for anti-aging. It helps with fine lines and wrinkles by increasing collagen production, helps keep your pores clear, and it helps with hyperpigmentation by increasing cell turnover. Mid-20s is a good time to start. That's when I started a retinol and tretinoin, and I would alternate them by the day. If you're pregnant, do not use any form of retinoid, especially oral retinoids like isotretinoin. That's too much vitamin A for a fetus. Topical wise, not as much as taking it orally in terms of exposure to the fetus, but just in case, don't do it. Now the next question is, when should I start Botox? Botox, I'd say probably in your 20s is a good time. Mid-20s is usually where my patients come in asking about Botox or neuromodulators. And Botox is a neurotoxin that works on muscle movement. It doesn't make you numb or feel or you lose sensation. It just makes your muscles not work as well in the areas that we carefully choose out and inject. So a very common area would be your crow's feet here. A very common area would be your crow's feet periocularly or around the eyes, the frown complex or your corrugators and procerus here that can cause the 11s when you frown, or if you're really surprised, your forehead muscles. Those are the 3 most common sites we put Botox into. And I say probably your mid-20s and up is a fine time to consider it. In terms of filler, I have patients in their early 20s asking for lip filler, for people trying to, plump their lips up they're doing those crazy trends with the cup and trying to get their lips bigger. But people have been asking for larger lips earlier over time. And so I'd say 30s and up is kind of the most common where I would do lip filler, but I'm even seeing people in their early to mid 20s for lip filler. And just a small amount does go a long way. So I do understand having a little bit of lip filler in your 20s can be helpful, but I'd say don't rush into that. That is more painful. It does have more side effects, more bruising and bleeding than Botox. Botox is like essentially painless. Filler though, for the mid face, I'd say 30s and 40s, a lot of times patients are really asking for that, especially 40s and up, where we start to get bone resorption there and people want to reconstruct the cheekbones and help with the nasolabial folds or the jawline here, and you want to lift things up. We put a stronger filler in this area to reconstruct bone and cheekbone and lift things up. The other question is, when do I consider devices like radiofrequency microneedling? Last week I did a resurfacing laser called the Lutronic Ultra. I just did a demo because we don't have a resurfacing device in our practice. And so I'd say it depends on what you're trying to achieve. If it's for acne scarring, I have done laser on teenagers with bad red scarring in terms of texture changes like rolling scars, ice pick scars, boxcar scars. Those involve divots in the skin, and you might need a resurfacing laser to help increase collagen and fill divots in. The hardest to treat though is ice pick scarring. And so I'd say it depends on how severe the case is and how much it bothers the patient. So it could be in your teens or 20s where you're gonna start a device for resurfacing. Fine lines and wrinkles though, I'd say probably 30s and up for a device. And they can be pricey. They can be a few $1,000s of your hard-earned money to go towards with one treatment, or you buy a package where you get 3 treatments and it could be $10,000 you could spend on a series of treatments for some kind of device. That really depends on the person. For red scarring, there is a V-beam or pulse dye laser that you can use to help with the redness. That helps with like broken blood vessels, rosacea, but also can help on red scars and soften those thickened red scars. So I've done that for younger individuals who've suffered from cystic acne. Chemical peels, we do quite a bit in my office. Chemical peels, I'd say mid-20s and on, kind of like when you're starting on a retinol for anti-aging. Chemical peels is a controlled procedure where we're using acids of various degrees, various combinations to cause micro trauma to our skin, whether at the epidermis, the first layer of skin, or the dermis, which is a deeper peel, and that will really help stimulate collagen production. When it's a superficial peel just affecting the epidermis, you're kind of just like working on pores. You might feel like you had an ultra exfoliation experience where your skin feels ultra soft afterwards. Whereas a deeper peel might work more on brown spots as well as collagen. And I've even had patients who felt like, ooh, it's tightened up the skin around the jawline. That's a nice result, but not something that we promise because you gotta go pretty deep to work on collagen. And there are different peels that can do it. I would never order one on online and do it at home. I've been seeing those TikToks and reels of people doing that, going on eBay and buying the peels that I perform in clinic and doing it at home and causing scarring. And so I would say don't do that. But I'd say mid-20s and up, you could consider it because it works really well with your retinol. Retinol is helping with cell turnover and helping with fine lines and wrinkles. So I think they work very well together. And so I do peels typically in the winter time or springtime. Fall is kind of when we start the chemical peel season, and then we end around early June here in Seattle. So I hope this video is helpful, and when you buy skincare, have a goal in mind and don't buy a ton of stuff because you saw a cool viral video on all of these awesome skincare products. So keep it simple, have a goal in mind, and be smart about what you buy. And so I hope to help you with that with my other YouTube videos on the channel. Okay guys, please share with your friends who are into skincare and cosmetics. And also please hit the like button, please subscribe to the channel, and I'll see you guys for the next video. Peace.